Hello everyone, it's day 42 and today I have April 14 The Hindu newspaper because on Sunday it is Sunday's edition and on Sunday there are no important article covered on in the Indian Express newspaper. But in the Hindu newspaper there are certain section important section such as science and FAQs, that is frequently asked question, which is important for the examination point of view. So I will cover these topics. And today is 14th April, which is Ambedkar Jayanti. So Bhimrao Ambedkar was born on 14th of April. So coming to the important topics, first important topic is on the page science, which is the page number 11 on the Hindus edition, today's edition, that is April 14th edition. So one important article is regarding the concurrent heat waves. Sea level rise pose a threat to coastline. So let us see what this article is going to argue. So the concurrent occurrences of heat waves and extreme short-term sea level rise at the same coastal location significantly increased between 1998 and 2017 when compared to preceding 20 years, as per a study published in the journal Communication, Earth and Environment. The study also suggests that these events may be 5 times more likely to occur between 2025 and 2049 under a modeled high emission scenario. The so-called concurrent heat wave and extreme sea level, that is CHWESL event, is a is a is when a heat wave and extreme short-term sea level rise occur at the same coastal location over a same period of time. Okay, so concurrent heat wave and extreme sea level event is when a heat wave and an extreme short-term sea level rise occur at the same coastal location over same time period. This can pose a serious threat to coastal communities. Yet there has been so far been little research into the characteristics and the occurrences of these events. So Shuo Wang and Mo Zhao from the Hong Kong Polytechnical University, Hong Kong, investigated CHWESL events worldwide between 1979 and 2017 and projected future events between 2025 and 2049 under a high emission climate scenario, the IPCC's SSP 8.5 scenario. The authors only included events occurring in the extended summer season, spanning May to September in the northern hemisphere and November to March in the southern hemisphere. The authors found that approximately 88% of the world's coastlines experienced a CHWESL event during the period 1979 to 2017. Approximately 39% of the coastline recorded a significant increase in the total duration of CHWESL conditions experienced over a year during the period 1998 and 2017 compared to during 1979 and 1998. With the tropical regions more likely to experience a greater increase, the authors also found a significant association between heat wave intensity and probably of a CHWESL event occurring, with a 1% increase in heat wave intensity associated with an approximately 2% increase in the probability of CHWESL event occurring. So, from their projection, the author suggest that the global coastal areas could experience on average 38 days of CHWESL condition each year between 2025 and 2049, an increase of 31 days compared to the historical period of 1989 to 2013. So the authors conclude that CHWESL events could pose a significant threat to coastal communities, particularly from the risk of excess heat to human health. They note that countries in tropical areas are likely to be the most severely affected, and that many of the countries are low or middle income countries, which may suggest to cope up with the effects. So this is very important article regarding the CHWESL event. So this can be asked in the. So let us see another important article which was coming in the news frequently of in the past week, that has just passed. So this on this page number 12, in the frequently asked questions section, there is a topic called why there is a WHO alert on viral hepatitis. So let us see what this article is about to say. So, what are the findings of Global Hepatitis Report 2024? What does India have? Why does India have such a high disease load of hepatitis B and C? Is the increasing prevalence of the non-viral form of disease like alcoholic liver disease and non-alcoholic fatty liver disease adding to the burden? So, hepatitis C is the disease which do not have vaccines yet. So, as the report says that hepatitis B can be prevented through vaccination, and the report highlights the need to ensure coverage. Hepatitis C is curable with medicines, though there is no vaccine available for hepatitis C. So let us see the story so far. The India accounted for 11.6% of the total viral hepatitis disease burden globally in 2022. making it the country with the second highest disease load after China. According to the WHO Global Hepatitis Report 2024 released recently, Bangladesh, China, Ethiopia, India, Indonesia, Nigeria, Pakistan, the Philippines, the Russian Federation, and Vietnam collectively shoulder nearly two-thirds of the global burden of hepatitis B and C. Okay. So, why does the report highlight? What does the report highlight? So, as per the report, the disease is the second leading infectious cause of death globally, with 1.3 million deaths per year, the same as tuberculosis, a top infectious killer. New data from 187 countries show that the estimated number of deaths from viral hepatitis increased from 1.1 million in 2019 to 1.3 million in 2022. Of these, 83% were caused by hepatitis B and 17% by hepatitis C. Every day, there are 3,500 people dying globally due to hepatitis B and C infections. Half the burden of chronic hepatitis B and C infection is among the people aged 30 to 54 years old, with 12% among children under 18 years of age. Men accounts for 58% of all cases. So, what is hepatitis? So, hepatitis is an inflammation of the liver that is caused by the variety of infectious viruses and non-infectious agents, leading to a range of health problems, some of which can be fatal. Says Sharad Malhotra, HOD, gastroenterology, hepatology, and therapeutic endoscopy, Akash Healthcare, Delhi. So, there are five main stream. There are five main strains of the hepatitis virus, that is A, B, C, D, and E. While they all cause liver disease, they differ in important ways, including modes of transmission, severity of illness, and geographical distribution. In particular, uh, types types B and C lead to chronic disease, and together are the most common cause of liver cirrhosis, liver cancer, and viral hepatitis related deaths. An estimated 354 million people worldwide live with hepatitis B or C, and for most, the treatment remains beyond reach, according to the WHO. Why is India vulnerable? So, doctors attribute the large number of cases to several reasons, including high population density, lack of awareness to symptoms, screening and treatment, and not adhering to or having access to good hygiene practices. Dr. Sudeep Khanna, senior consultant a gastroenterologist in the Indraprasth Apollo Hospital, explained that one of the major reasons for the increasing burden of the hepatitis in India is the high prevalence of chronic viral hepatitis B and C infections. These chronic infections often remain asymptomatic for decades. Furthermore, the lack of widespread screening programs and limited awareness about the importance of hepatitis testing contribute to a significant portion of cases going undiagnosed. Undiagnosed cases continue to transmit the infection, perpetuating the cycle of transmission and leading to a rise in overall burden of the disease, he said. The physician the physician added that another important factor contributing to the rising number of hepatitis cases in the increasing prevalence of non-viral forms of disease such as the alcoholic liver disease and non-alcoholic fatty liver disease. Doctors note that the high consumption of alcohol, particularly in urban areas, has led to a significant increase in the ALD cases, that is, alcoholic liver disease. Additionally, the rapid rise in the obesity and metabolic disorders, coupled with the sedentary lifestyle and the dietary changes, has fueled an epidemic of NAFLD in both rural and urban population. These conditions can progress to more severe forms of liver disease, further compounding the burden of hepatitis in India. Men report a larger number of cases. Manoj Gupta, HOD, liver transplant, and GI surgery, PSRI Hospital, Delhi, states that this is due to the high risk of behavioral behavior like use of IV drugs, sharing injection while using IV drugs, and sexual behavior. Multiple sex partner or male to male sex is a very high risk factor for these hepatitis B and C infection. So, how can it be prevented? Hepatitis B can be prevented through one second vaccination, and report highlights the need to ensure coverage. While hepatitis C is curable with medicine, in India the number of deaths due to viral hepatitis aren't to comparable to tuberculosis, says experts, adding that cost of treatment is also among the lowest as India makes the generic version of the drugs. Also, the government's viral hepatitis control program offers the vaccine to high risk adults such as healthcare workers. To treatment for both hepatitis B and C is available under the program. With an initial rollout of the hepatitis B vaccine in certain cities and districts of India in 2002 2003, the Indian government included chronic hepatitis B infection vaccine in the childhood immunization program in 2011 to 2012. So, why is the report significant? This is the first consolidated WHO report on the viral hepatitis epidemiology, service coverage, and product access with data for action. This report presents the latest estimates on the disease burden of the disease burden and the coverage of essential viral hepatitis services from 187 countries across the world. It also found that across all regions, only 13% of the people living with chronic hepatitis B infection has been diagnosed, and approximately 3%, that is 7 million, had received antiviral therapy at the end of 2022. Regarding hepatitis C, 36% of people had been diagnosed, and 20% had received curative treatment. So these results fall well below the global targets to treat 80% of the people living with chronic hepatitis B and hepatitis C by 2030. However, it does indicate a slight but consistent improvement in diagnosis and treatment coverage since the reported estimates in 2019. So what is the way forward? So mother to child transmission is responsible for most new infection, and in India, elimination of hepatitis B requires extensive treatment coverage, immunizing and protecting every newborn, and ending any discrimination against patients, said Dr. S.K. Sarin, the Vice Chancellor, Institute of Liver and Biliary Sciences, Delhi. The report cautions that despite the availability of affordable generic viral hepatitis medicines, many countries fail to procure them at lower prices. Pricing disparities persist both across and within WHO regions, with many countries paying above global benchmarks. So the report adds that the service delivery remains centralized and vertical, and many affected population still face out of the pocket expenses for the viral hepatitis services. It has outlined a series of actions to advance a public health approach to viral hepatitis designed to accelerate progress towards ending the epidemic by 2030. This must look at expanding access to testing and diagnostics, shifting to policies for equitable treatment, strengthening prevention efforts, and improved funding both at a global level or within countries' health budgets, said WHO. So this is all about this article. And one other important article I found, the trends in climate change jurisprudence, or yeah. So this was the article about the. I think we have covered this article in the Indian Express explained page only. So there's an article about the guardian of the revolution, that is Iran's Islamic Revolutionary Guards. So Iran has in the morning attacked Israel, and moreover, Iran's Revolutionary Guard has been termed as a terrorist organization by the USA. So let me see if there is another. So there is a article about the zero science, the science related to aging. So this is a short article. Let us see. So Dr. Daniel Balsky, an epidemiologist at the Columbia University, New York, has coined the term zero science, meaning geriatric or related to age. Here he has devised a novel blood test which determines the pace at which a person is aging. His group has devised a method which studies the formation of methyl groups through the enzyme in the DNA of senior citizens and finds that this methylation is sensitive to aging. So let us see the tool to target aging. Several groups are working on drugs and other related methods to modulate zero zyme and how these efforts affect his/her aging. One group has suggested that the drug called metformin is a tool to target aging. Another group has shown that if we inhibit the enzyme TORC1, it will enhance immunity and reduce the infection in the elderly. More recently, Manic Kit al. In a paper in Nature Aging has reviewed the effects of the drug rampicin on the longevity and survival of animal models of human diseases, and how we may make a drugs inhibitor a part of the standard of care for disease of aging. So this is an important thing, that zero science, the new term has been coined, which means geriatric is related to age. So zero science, the term we should know. Another term that we have seen here in CHWESL, that is concurrent heat wave and extreme sea level event. So this we should note down, important article. So that's all from today's newspaper. We'll meet with another important articles on Monday. Till then.